All right, it's 8 o'clock. I think we'll get started because we're only going to be together for about an hour. And as people arrive, we welcome you. We're excited to have such a wonderful turnout tonight. We first had this panel at the Mabin School last June, and we asked them if they would come back and join us again, and they said yes, to our great amazement and gratitude. We hope we won't have to have another panel discussion because we hope this will all be over soon. But I want to introduce myself. I'm Nancy Steinhauer. I'm the principal at the Mabin School. Welcome to the Mabin School. The Mabin School is Canada's first independent Ashoka Changemaker school. We're a small school with a big vision, and so we're excited to have such distinguished panelists with us here tonight. 3 changemakers in the community of Toronto and the world in medicine to speak to us about COVID-19. A few thank yous before I introduce our speakers. We want to thank the Weisberg family who connected us to our speakers in the first place. And I want to thank the Mabin staff behind the scenes who are making this happen: Diana, Graham, Michelle Barchuk. And we have 3 very supportive people from Kira Systems helping us with technology tonight. That's Russell and Zach and Maria. Thank you so much. And of course, the biggest thanks goes to our panelists who are so grateful that they're spending time with us tonight. Our first panelist is Ronnie Cohen, Dr. Ronnie Cohen, who's the president and CEO of Sick Kids Hospital. Our second panelist is Dr. Michelle Science, who's an infectious disease physician at the Hospital for Sick Children. And Dr. Jeremy Friedman is the Associate Pediatrician in Chief, Department of Pediatrics at Sick Kids Hospital. And each of our panelists will spend a few minutes introducing us to some of the topics that were sent to us ahead of time. Ronnie will set the context of what's happening right now. What have we learned about COVID? Michelle will talk about infection prevention and control. Jeremy will talk about the new variants and the risk to children. And then we have some specific questions that were sent to us ahead of time, which we will have the panel answer. If there's time at the end for more questions, we will try and answer those too. So if you have questions while we're talking, please don't hesitate to put them in the Q&A part of the Zoom call or the chat, and we will monitor those. And if there's time, we'll come back to those as well. Anything we don't get to tonight, we will try and send out to you via email afterwards. And with that, I'm just going to remind people that we are recording tonight's session, and we will share it afterwards. So with that, I will hand it over to Dr. Ronnie Cohen, and thank you.
Thank you, Nancy, and welcome everyone. Thank you for having us and joining us tonight. So as Nancy said, all of us will try to touch on a number of themes that came out through the questions you sent, and then we can go through some of the general questions. So let me first make a couple of comments on where we are and what changes have happened over the last few weeks. I think most of you have seen that we had a steady increase in our numbers of COVID positive individuals, as much as we had an increase in our patients who had to be admitted to ICUs in general, to the hospital. So there was a significant strain on the medical system, particularly at the beginning of the year. We now see a trend of cases going down. I do want to make this point. It's interesting, we are almost a year into this and we still hear most of the media talking about daily numbers. The daily numbers are only so informative in the context of how many tests we are running each day. So it's really the positivity rate or the cases per 100,000 that give a much more meaningful idea about where we are standing. But overall, taking everything into the context, our case numbers have dropped and continued dropping over the last few weeks. And we are now slowly seeing a trend, and I'm saying it carefully, but we're slowly seeing a trend of ICU beds going down and some of the numbers of patients in some of the hospitals um, that are decreasing as well. And we hope we are going to continue to see this trend. A number of you have asked questions about our document and the collaboration with government and public health units. So I want to make a couple of comments about this to clarify potential or to clarify a few misconceptions, let's put it this way. So back in May, a number of colleagues got together with myself as we began to realize that this pandemic is going to stay with us for a while. And initially, we were just thinking about certain advocacy letters that we could write in newspapers and in journals and articles. And then through discussions, we felt like maybe a bigger contribution would be to think about how could we open schools. I'll talk about camps in a second. To tell you the truth, everything actually started with the idea of how can we open summer camps, but I'll talk about this in a few minutes. So this was a grassroots effort and has continued to be a grassroots effort that initially started with just members of the sick kids community, including parents and a few teachers who were associated with the sick kids hospital. And then over the course of the summer, really became a large collaboration among all children's hospitals and a number of infectious disease specialists, academics. So this document really was meant and is meant to be a guidance for the ministry as much for schools to help think about what has to be in place in order to open schools safely. So we have had very fruitful collaborations with government and with schools and with public health units. At the end of the day, though, the implementation of what our guidance document is suggesting is up to the school boards and the government. And so that is kind of the nature of our document, and that I will say these were all fruitful and continue to be fruitful collaborations, but at the end of the day, the implementation decisions are not ours. They are with the government and school boards. Jeremy is going to talk about some of the new variants, which I'm just going to say for a minute. What we do know is that these variants that initially have been detected in the UK that are now here, and we are now also seeing the variant that has initially been detected in South Africa here in our community. They do show evidence of higher transmission. Anything beyond that, we currently don't know. I know there are a lot of reports about whether it's potentially more deadly or so. I don't think we have any data at the moment to support this. And at the moment, from everything we know, the public health measures that are currently in place, like physical distancing, wearing a mask, washing your hands, should protect you from these variants too. There's just a little bit less wiggle room when it comes to these variants, given that the transmissibility is significantly higher than with the previous variant of COVID. So let me talk a little bit about vaccines, because there are a lot of questions from individuals around vaccines. I will admit that this is currently a frustrating situation, given the fact that the supply chain in terms of the deliveries of vaccines to Canada is very low. It was absent for a while. Now it's slowly picking up again. And in general, I'm an eternal optimist, and sometimes it's more difficult these days than other days. I am convinced that we will get the promised doses by the end of March, which would allow us to immunize all the long-term care residents, all the long-term care staff members, as well as frontline healthcare workers. We are currently in a situation where the few doses that we have in hand are being directed only towards the long-term care residents, and although this has been frustrating for a number of the healthcare workers, including a number of staff physicians at staff healthcare workers at Sick Kids, I do think it was the right decision to do this. Up to 75% of individuals who are unfortunately dying every day are really people in the long-term care facilities. So the more we can protect this population, the more beneficial the impact is going to be. In our document, some of you may have read it, we are advocating that teachers will become high priority as soon as the first stage 1 is completed, hopefully by the end of March. And from discussions that I personally have had with a number of members of the Ministry of Health and Ministry of Education and a few of my colleagues, I do think that teachers will be at the front of the line, starting probably April. And that will be together with individuals who are 60 and up, as well as a number of other essential workers, whether these are workers in grocery stores or factory and plants. So I think this will allow us to hopefully vaccinate the individuals who are at highest risk, either through their jobs of being exposed, or the individuals who are at highest risk of getting severely ill, hopefully by the beginning of the summer. And that, I think, in itself will have a significant impact on the pandemic situation. I mean, we are getting daily updates almost around the large clinical trial quote that currently happens in Israel. As most of you know, the country has now immunized 39% of the population, and they have really focused on everybody at 60 and up initially. Now they're going lower, but you can see in preliminary analysis, these are preliminary, but the preliminary analysis show a significant beneficial impact on hospitalization, on severity of disease. So it looks like that the vaccines are working. If anybody has specific questions about what type of vaccines there are, I'm happy to answer this later. Currently, we have 2 vaccines approved here. There are another 3 actually that are being currently evaluated by Health Canada. So I think within the next few weeks, you will see the approval for other vaccines, and that will also help with the increase in supply. At the moment, the lowest age where clinical trials have been conducted is the age of 16. So the Moderna mRNA vaccine, the clinical trial went to children of 16 and above. And both Moderna and Pfizer have now enrolled children between the age of 12 and 16. We expect these results to be public probably by the beginning or midsummer. So a lot of you have asked the question about when are we going to start vaccinating children. I do think that it will probably be until the fall until we start vaccinating children. I do think it's important to look at this in the context of what Jeremy is going to talk about, that children by and large don't get very sick from this. And while there are a lot of discussions around how much children are transmitting COVID-19, and they of course transmit, the degree to how much is obviously quite controversial still and is heavily debated. But I do think that the scenario, if you think about your personal life and if you think about schools, even if children are not vaccinated, but most of the adult population, in particular the older population, is vaccinated, that in itself will have a very positive impact on our situation. And hopefully throughout the year will contribute to the opportunity to downgrade the pandemic to maybe an endemic, and life will hopefully look much better as we go on throughout the year. Last comment I make is around summer camps, because a lot of people have asked questions about summer camps. So like I said before, initially when we got together with some of my colleagues, our goal was to think about what would have to be in place, what would have to be true to open summer camps last summer. In conversations with the Ontario Camp Association and a number of other camp directors, it became clear, though, that the risk of trying to think about how to do that was too high. And then public health and the government also came out with a directive to keep overnight camps closed and only open day camps. Now, the conversation has now shifted, and we have been in touch with the Ontario Camp Association, who are doing, in my mind, an outstanding job trying to think about how you can create a safe environment for overnight camps. And it's very interesting. A lot of the ideas we exchanged back and forth last year are now coming to fruition. So while I don't know for sure whether it's going to happen, I can assure everybody who has been asking questions that there are a lot of people working on it. We are trying to support the Ontario Camp Association as much as we can in terms of, we have looked at some of the protocols, provided feedback. I've written a supportive letter. And you will probably hear updates around summer camp throughout the next few months. So for now, I'll stop here and turn it over to Michelle.
Great, thanks so much, Ronnie, and thank you for having me back to speak. I see that someone has already asked if my child is going to make an appearance again, and I can say it's highly likely that one of the three will come and interrupt. I was not successful getting them to bed before this talk, so I apologize in advance. I'm going to actually share a couple of slides just to show some of the recent data. So I'll see if I can share my screen here. Hopefully you can see that.
Yes, we can.
Wonderful, thank you. All right. Okay, so I'm going to start showing some numbers here. So this is data from Ontario, which shows the daily case counts and rates by episode date in Ontario. So this is dating back to the beginning of December up until more recently. And always important to note that this gray area, it looks much better, but this is where data can change as a result of lags in case identification, reporting, and data entry. So these numbers in the gray area will likely change. But you can see that overall, since the start of the lockdown just before the new year, that there's been a gradual decrease in the number of cases, as well as Ronnie mentioned, the percent positivity. So although we need to continue to monitor, there is that downward trend that we have been looking for. In terms of what we're seeing by age, so this is Canadian-wide data, and you can see of the total number of cases where there is data, so of 760,000 cases, you can see that about 16.2% of those are in children less than or equal to 19 years of age. When you look at disease severity in those children, about 640 or 1.5% have been hospitalized. ICU admissions are 90 at 1.2% and few deaths at 4%. And so compared to other age groups, we are seeing a little bit more of an increase than right at the beginning of the pandemic. And this goes to show us that kids can get infection with SARS-CoV-2. But similar to the data I just showed across Ontario, if we look at the Toronto Public Health data in terms of medical interventions, we can see again that very few children are requiring hospitalization when they get sick, and even fewer need to be admitted to the intensive care or require intubation in the intensive care. And so one of the questions that I was asked to answer was, is it safe to go back to school? And so from a pediatric perspective, as I mentioned, the majority of children with SARS-CoV-2 infection have mild symptoms or no symptoms at all. So for their individual safety perspective, I'm not as concerned about children attending school, especially with all of the health and safety measures in place. But of course, we need to consider the impact that return to school may have on community rates, especially with the new variants that Ronnie was referring to. But overall, the experience from other countries suggests that schools can reopen safely with health and safety measures in place, but we'll need to monitor the situation closely moving forward, especially as we said with the variants. We'll need to continue to balance the health risks of SARS-CoV-2 in children and children's potential role as transmitters of SARS-CoV-2 with the significant harms of school closures on children's physical, developmental, and mental health, as well as their learning. So I was also asked, what can schools do to make it safer? And I'm going to talk about some of the individual measures, but I wanted to start by saying that overall, the experience of return to school in September went well with the health and safety measures that were put in place. So I don't want to suggest that schools were not safe before and the health and safety measures were ineffective, because I honestly believe that they have been effective on a larger scale, which is really largely to do with the amazing work the schools and especially the teachers have done implementing all of the measures. But what we've learned in healthcare and in long-term care is that there's always room to do more. And with the variants of concern, there appears to be much less wiggle room, as Ronnie mentioned. So it's really critical. It's also really critical that we continue to do our part to keep community transmission low. So with return to school, it doesn't mean that all of a sudden we forget about all of the other public health guidance around group gatherings, mask wearing, and otherwise. Just because our children are gathering in school in the classroom doesn't mean we should start having large gatherings or parties outside of the classroom. We all need to do our part to keep community transmission down by following the guidance from our local public health units. So now I'll move on to talk a little bit about some of the enhanced measures that are being put in place in school with the return to school in light of the higher case counts and variants of concerns. But first, I want everyone to note that it's likely that there will be a case of SARS-CoV-2 identified in your school. It's not possible to eliminate all risk of introductions into the school because the virus is circulating in the community. So identifying cases in the school shouldn't lead to sudden panic. This is why all of the health and safety measures that I'm going to talk about are in place so that when cases are introduced into the school, there is limited to no transmission. So quick reminder about how the virus is spread. This is an excellent infographic from Toronto Public Health, and it reviews the main ways that the virus is spread. So on the far left here, you can see that the main mode of transmission is by close contact with an infected person when they talk, breathe, or sneeze. And this is why there's the recommendation to stay 6 feet from others and wear a mask. The next one here is that people are contagious when they're sick and the 2 days before they show symptoms. So this is why it's so important to stay home and self-isolate and get tested if you're sick. And also if you've been exposed to someone that's sick, that's why there's the recommendation about self-isolating during the incubation period. The next one here with the hands is talking about the respiratory droplets that can land on surfaces. We know the virus can live on surfaces for hours. It's not that easily spread that way, but there still is recommendations about making sure your hands are clean. That's why we talk about hand hygiene and also cleaning the surfaces and avoiding touching your face. And then the last one I'll touch on quickly is the smaller respiratory droplets called aerosols. We know that they can linger in the air before falling to the ground. And this is where opening windows to increase airflow and ventilation can play an important role. So understanding this spread has really led to the various health and safety measures that have been recommended, including the daily screening, hand hygiene, physical distancing, cohorting, environmental cleaning, ventilation, the use of non-medical masks, and a robust public health response when cases are identified in school. And you can see that there's this hierarchy of controls from the CDC that describes the bundle of measures that we've recommended to put in place to keep schools safe. And so diving a little deeper into a couple of these, I'll start with symptom screening. It's really essential that students and staff stay home from school if they have signs or symptoms of SARS-CoV-2. One of the issues is that there are many different signs of SARS-CoV-2 in children. And so you can see the screening tool from Toronto Public Health here. It talks about the various symptoms. And different public health units have different approaches, but in Toronto, where we have higher case counts, Toronto Public Health is appropriately taking a more conservative and sensitive approach by requiring testing for the presence of even one of these symptoms. And so if you have any one of these symptoms, it's recommended to stay home and self-isolate and get tested, or if you have questions, you can contact a healthcare provider. Aside from symptoms, there are other circumstances when it's recommended that you stay home. And I understand that Toronto Public Health will be providing further guidance around this next week before the return to school. But essentially, if you have household contacts that have symptoms, household members who have traveled outside of Canada in the past 14 days, or anyone in the household has been notified as a close contact or told to stay home as self-isolate, these would be reasons where children should stay home and follow the public health advice. And of course, for those with symptoms, when you do get tested, if the result is positive, then you would be required to stay home and self-isolate for 10 days from the days that symptoms started. And you can see the other guidance there, and this is all on the Toronto Public Health website. If the test result is negative, the child can return to school if it's been 24 hours since their symptoms started improving. And then if you're not tested, given the current epidemiology right now, the recommendation would be to assume that that it could be SARS-CoV-2 infection causing the symptoms and to isolate as if it were infection. Other measures like hand hygiene, environmental cleaning, distancing, and cohorting will continue to be important, but there were a number of questions related to masking, so I thought I'd talk about that next. As you are aware, the evidence has continued to grow about the importance and effectiveness of masking for source control. And you can see here in the diagram or the picture on the left there, how a cloth barrier can help prevent or reduce the amount of virus that's released. There is also more evidence that non-medical masks, especially those with multiple layers, may be protective for the individual. So while there are negative consequences related to masking, which I've listed there on the right, at this stage of the pandemic, with our current epidemiology in Toronto, weighing the risks and the potential benefits, it does make sense to recommend non-medical masks by students in schools, especially indoors. In terms of the type of masks, masks should be made of at least 2 layers of tightly woven fabric, such as cotton or linen, and if possible, a middle filter layer. And this 3-layer type mask can provide added protection. But also with children, you need to consider what will be comfortable and practical for them to wear for longer periods of time. There are good resources about masking and the types of masks on the Public Health Agency of Canada website, as well as on the Toronto Public Health website. So I'll also draw your attention to this sheet this resource that's available on the Public Health Ontario website, which has some cold winter tips for schools. Some public health units are recommending masking outdoors when physical distancing can't be maintained. So if this is the case, it's going to be important to note that more masks will be required. They get damp really quickly and they'll freeze and they'll need to be changed. So make sure you're sending enough masks with your children when they go back to school. The last area I will talk about before handing it over to Jeremy is testing. So with return to school, and for those of you who may have read the guidance document, we talk a lot about testing and how identifying cases and contacts are really going to continue to be an important strategy to keep schools safe and open. This is where students and families play an important role in getting tested when you have symptoms, and also when it's recommended by public health after an exposure. The testing after an exposure is one I want to emphasize because people often ask why it's important for them to get their child tested if their child is well and they don't have any symptoms. And the reason it's important is not only to detect asymptomatic cases to prevent further spread within your family and beyond, but it also helps us to get a better understanding of the frequency of spread in classrooms so that health and safety measures can be properly evaluated and adjusted as needed. SickKids has been working closely with Toronto Public Health around the testing strategy, and we've been promoting the use of less invasive samples, so like saliva and oral nasal swabs, and also trying to improve the ease of access to testing with take-home options, like take-home saliva kits, and also on-site testing at schools. There's also a plan moving forward to monitor for variants of concern on specimens that are positive. So I'm sure you'll get more information around testing and the exact strategy that will be rolled out in your area, because it does depend somewhat on the testing partner linked to your school. But I can say that the ongoing focus will be on promoting testing of symptomatic students and testing of around exposed cohorts and in outbreak scenarios. And so I'll leave you with this, again, another tip sheet from Toronto Public Health on tips to stay safe and healthy in school. This still all holds true now, even with the variants of concern that we've been seeing. And I'll hand it over to Jeremy.
Thanks, Michelle. And thanks to the organizers for inviting me back. I was actually just reading something in the British Medical Journal today, which basically said, the person said, the more certain someone is about COVID-19, the less you should trust them. And I thought that's actually not untrue, particularly when it comes to social media and some of the stuff that you read in the media. So with that disclaimer, I have actually just finished a 2-week stint on our one ward that where we put all of our COVID positive patients in the hospital. So maybe I'll just share a few impressions. When I spoke at the webinar last June, we had only admitted a handful of children with COVID. At this point at SickKids, we've admitted about 100 children. Probably about half of them have been admitted because of symptoms of COVID. A few of them have had to spend a little bit of time in the ICU, but on the positive side, they've actually all done very well and they've all been discharged from hospital in good health. Most of the others have been admitted for medical or surgical reasons, and we test every single patient who's being admitted to hospital. So some of those patients were just picked up incidentally and were actually asymptomatic. And then there's a very tragic small group of particularly young babies who come from families where a number of the family members have been really sick with COVID and hospitalized, and basically there's no one to look after the child, so we've taken over the care for them. But I would say that in general, the burden of illness has been very small in kids. We know in the community, as Michelle alluded to, probably 30 to 50% of children who get COVID will be completely asymptomatic, and those that do get symptoms will be much milder than adults, and predominantly it's fever, cough, sore throat, nasal congestion, not unlike many other respiratory viral illnesses. Obviously, we all heard about the tragic case of the 19-year-old in London, Ontario, a couple of weeks ago, who had been working in a long-term care facility and passed away as a result of COVID. I don't know the actual details, but from my understanding, he would be the youngest person that had actually passed away from COVID in our province. The other area that is important to remember is that what we have seen in the last year is the emergence of this new condition known as hyperinflammatory syndrome or multisystem inflammatory syndrome, MIS-C, which tends to occur about 3 to 6 weeks after infection with SARS-CoV-2, and the infection might be asymptomatic, so the child and the family might not actually even know that the child had been infected. And about a month later, the child presents usually with a very high persistent fever for more than 3 days, associated with either gastrointestinal symptoms like vomiting, tummy pain, and diarrhea, or symptoms usually associated with something called Kawasaki disease, which is predominantly red eyes, red lips, skin rash, and sort of swollen red palms and soles. And what we've seen in Toronto is that every time there's a surge of cases in the community, about a month after that, we tend to see a cluster of children presenting with this hyperinflammatory syndrome. And over the course of the year that the pandemic's been going on, we have looked after about 120 children at the hospital with this condition. Again, a small percentage have required a few days in the intensive care unit. But the good news again is that they've all responded very well to treatment, and they've all been discharged in pretty good health. There is a small group that, similar to Kawasaki disease, do get a little bit of inflammation of the coronary arteries to the heart. Most of those have settled down, but some of them are still being followed in the clinic to make sure that that all gets settled. The other thing that I would mention that has certainly been noticed internationally is that both the acute COVID illness in children as well as the MIS-C tends to be disproportionately in children of color. So a much higher percentage of children of color are affected than you would expect from the population. And we've noticed that at sick kids as well. That said, so in general, the burden of illness in children is relatively low, but I should point out that at the same time, the sort of data that we have seen with regards to mental health symptoms in children and adolescents is not that encouraging. Certainly with the lockdown and social isolation and school closures, there've been a lot of surveys, and some of the data is quite hard to interpret, but I would say that in a nutshell, it does seem clear that both children and parents have reported significant increases in mental health symptoms like anxiety, depression, inattention, and this is both in children who've had problems pre-pandemic as well as children who had no problems at all. And these things are borne out by, for example, the Kids Help phone line, which is a 24/7 helpline across Canada. The number of calls in 2020 more than doubled from the number in 2019. And unfortunately, we've seen, certainly in the last few months at Sick Kids, quite a significant uptick in the number of children being referred and having to be admitted for mental health complaints, as well as for eating disorders. So on the one hand, not a huge burden of illness relative to adults, but on the other hand, some very significant impact of the social isolation with school closures, which basically, is one of the big rationales why, as an institution, we have been promoting opening of schools with all the mitigation strategies that Michelle has talked about, because we do feel that is absolutely in the best interest of children. I was asked to talk about the new variants. I think Ronnie has kind of summarized most of what's known. I think many of you will have heard about the most is known about the variant that was first discovered in the United Kingdom. And more recently, there is another variant that was identified in South Africa and in Brazil. The data is fairly preliminary, but I think it's fairly clear at this point that the UK variant does seem to be more transmissible, felt to be probably 50% more transmissible. So certainly is likely to be more contagious than the initial virus. And whether or not it's a little bit more virulent is still up for debate, but certainly there is some opinion in the UK that there might be some increase in mortality as a result of the new UK variant. I think that the more important question at the moment is how well will the vaccines cover for the variant? And again, it's probably too early to say anything definitively, but our understanding from what we've seen so far is that it's fairly encouraging in that the hope is that the vaccines will still be effective, maybe not quite to the 95% level that was reached in some of the trials, but that the efficacy will still be significant, and that's going to be really important. So I think those were all of the initial comments that I think I wanted to make, and hopefully we will have lots of time for a Q&A.
Thank you so much. So when people registered, they sent in questions, and we sent those along to our panelists. And so we have some specific questions for the panelists to answer based on the trends that were in our participants' questions. So the first one is, please comment on children's mental health and what we can do to address this issue right now. How can we support children's mental health?
Yeah, so I think Jeremy summarized the complexities around mental health really nicely. It is a really, really broad term for a lot of different issues and challenges that I think all of us experience who have children. And when I say all of us, there are children like my own child who grows up in a privileged environment and has all the support needed, and the school is doing all they can. And I would assume most of you would consider yourself privileged. And even for those children, it is challenging to be at home, to not interact with their children. But if you think about this for a second, if it's difficult and challenging for our children, how difficult and challenging is it for our children who are already living in vulnerable conditions with their families? So that is one of the reasons why we are heavily advocating for a very precise and targeted approach for these communities where you have already a very vulnerable and fragile family situation. There is no, I wish I could give you a playbook. So I'm not a mental health care provider per se, and I wish I could give you a playbook. A couple of things that our colleagues in psychiatry are often discussing with their families is there is no way that you can avoid not talking about COVID because it's on everybody's mind. But we have experienced from feedback from families that we shouldn't underestimate that the constant discussion around what you hear in the media, what you hear in the social media, is having a huge stress impact on children. So Jeremy was talking about the unprecedented eating disorder crisis that we are seeing right now. Now, this is not just related because of initial isolation from home and not going to school. This is a complex reaction to the entire stress of the pandemic, to the situation we are all exposed to. So trying to find some structure within your household and not constantly discussing the stresses around the pandemic is one important advice that we often give. Trying to spend time with children, even if it's virtually, not just hanging out, but trying to think about how you can play with each other. The older your children are, the more you can encourage to play with other children. Try to make sure that you can still go outside and go for a walk and have some physical activity. I think that is something, interestingly enough, in a lot of conversations I've had with teachers over the last few weeks, what they're most worried about, that the physical activity of children is so limited right now. So, so far, I'm knocking on every wood, the winter hasn't been that bad and you can go outside. So try to make sure that you get your children outside so that they're physically active a little bit as well. And maybe I'll leave it at that here. If anybody has specific questions, send them to Nancy. She will send them to us and we'll get back to you in writing.
Thank you. Another question that came up a few times was, how should grandparents interact with their grandchildren once schools reopen?
Yeah, so this is a question that we get asked a lot. And I think, ultimately it comes down to a personal choice. And it depends on the risk thresholds of all of the people involved. So we know that when children return to school and when, in general, when things start to reopen, the risk of a child being exposed and infected with SARS-CoV-2 is going to increase. And this needs to be taken into consideration when you're weighing the risks and benefits of interactions with more vulnerable people. So when public health guidance allows, if people choose to have those interactions, there are several measures that can be put into place to reduce the risk. So things like having those interactions outdoors, maintaining distancing, and the use of face coverings can all help. But it does come down to a personal decision.
Thank you. This is one that comes up a lot. How should parents manage screen time for their children right now?
Yeah, so I can tell you I've learned something throughout this because many of you have probably seen it. In fact, some of the research came out directly of sick kids from one of our colleagues, Dr. Catherine Birkin, who did some studies around the amount of screen time. And when I spoke to our psychiatrist over the last few months, she actually pointed something important out. There are different types of screen time. So if you take the entire amount of screen time of your children right now being online at school and then probably spending time on their iPhone and iPad, then of course it exceeds every recommendation that has ever been made for children and screen time. But it should be really looked at differently, whether you are sitting in front of a computer and do online schooling, and whether you sit then in front of, I don't know, PlayStation and iPhone or iPad. So I think what is important is that you try to reduce the amount of screen time after online schooling. And when I say reduce, I choose my words carefully and not say eliminate, because I think it is critically important that children interact with each other. And at the moment, the only option for children to speak to each other, either individually or within a group, is going to be through Zoom calls, FaceTime, and so on. And you can encourage this. Just try to set a limit that your children are not spending the entire time of the day in front of the screen.
Thank you. That fits nicely with the next question. How do I encourage social skills without any play dates? Do virtual play dates with other kids have the same effect? If they aren't experiencing different environments and new things, how does that affect early child development, and how can I compensate for that?
So I'm not really an expert in this area, but I'll give it a shot. I do think there are quite a few resources on the web that have been set up. For example, the Canadian Pediatric Society or the Sick Kids About Kids Health has some resources that might be helpful in this area that the last few questions have related to. I guess a few principles. First of all, I would say that parents shouldn't be too hard on themselves. I think I've always said that being a good parent is way harder than being a good pediatrician. And that's at the best of times. And these are not the best of times. So I think we should all probably be a little less hard on ourselves. I think I would reiterate a few of the principles that Ronnie has said. I think we can still encourage social skills through virtual, whether it's through Skype or whether it's through FaceTime or whether it's through playing board games or other games with friends using technology. I think there are lessons that parents can help children improve their skills, whether it's in communication or self-regulation or sportsmanship or whatever, that you can actually achieve some social and developmental lessons through that. I think in terms of technology, Ronnie has intimated already that the interactive part is the important part. So way more important to to sort of potentially play a game interactively with a friend, as opposed to sitting just passively in front of a screen. I think we've always said books are better than screens, but if you are going to be watching screens, you know, sitting with a child and trying to have some discussion around what they're watching, what their interpretation of it is, trying to make something educational out of it is really helpful. And then I would say, you know, as parents, the best thing that we can do is to get down on the floor with our kids and read to them and play with them and do family board games. And you know, I think those are all developmentally extremely important. So just a few arbitrary things that I think we can do.
Thank you. There's a question here about the role of ventilation in preventing the spread of COVID-19 in schools. And there was a question in the Q&A about, do portable HEPA, you know, portable air filters with HEPA air filters really work? Can someone comment on that?
Sure. So I didn't touch on it in detail in my opening remarks, but ventilation is an important consideration to reduce transmission risk in schools. It's one of the 3 C's that the WHO talks about avoiding. So for those of you who may not be familiar with the 3 C's, it refers to crowded places, close contact settings, and confined or enclosed spaces with poor ventilation. And so improving ventilation is an important strategy as part of the overall bundle of health and safety measures. And I know that schools are looking into this, whether it's through optimizing the outdoor air, through the centralized HVAC systems, using portable filters, opening windows more often, or increasing outdoor education time. There's a number of strategies that can be used to help improve ventilation as part of the bundle of measures.
Thank you. Do you feel that the provincial government is responsive to your concerns about the mental health impact on children in their decision making?
So I would say 100% yes. I think there are a lot of questions about how much is the government following our advice to the dot and the T, and I don't really want to get, I think I touched on it in my beginning remarks, but if I can say anything from our multiple conversations with members of the government, they do recognize the challenges and the pressures around mental health for children. And I think that was one of the driving forces for government to ensure that schools could open in the fall and are opening now.
What is your recommendation to best reduce the spread in an early years educational environment? I know this is a big concern because the littlest ones really have a hard time distancing and even wearing their masks. So what's your advice about how to best protect, especially the staff in early years educational environments?
Yeah, so it does come back to that bundle of measures, bundle of safety measures, which is similar throughout the grades, but there's slight variation based on age-specific considerations. So for example, in the younger grades, as you mentioned, the strict physical distancing is more difficult to enforce. And children also need that social interaction, especially at some of those younger age. So this is where a cohorting strategy, so where each child has a small, consistent group of children that they interact with. And that sort of strategy used with masking can add another layer of protection to allow those close interactions.
Thank you. We only have a few minutes left. We'll see how many questions we can get in. How can we plan for supporting students in the not so distant future when school is back in session? I think this one's for you, Michelle, again.
Sure. Yeah. So I think, Ronnie and Jeremy have touched on this quite a bit already. I mean, I think the mental health supports continue to be critical. And then with respect to the health and safety measures, I do think it's important to continue to talk about the measures, explain the rationale for them, and, discuss their importance in school and at home. But I do think that the mental health supports will continue to be very important.
I'm I'm going to skip ahead a little bit to another question. Any more learning on potential long-term impact from kids who have had COVID? This one's for Jeremy.
Yeah, so people have probably read quite a bit about long COVID in adults. There's certainly a lot that's being written about folks who've recovered from the acute COVID illness, and even a month or 2 or 3 later are still having persistent extreme fatigue, chest pain, shortness of breath, joint pain, muscle pain, inability to sort of focus, or feelings of depression. So lots of fairly non-specific symptoms, and that's known as long COVID. Depending on where you read, sometimes 10 to 20% of populations have been described. I would say in children, there's really almost no data. It's all just anecdotal. Certainly, we have heard anecdotally of children who, even after recovering, have had, for example, persistent loss of taste or loss of smell, which are some of the acute symptoms. But there's nothing really definitive at this point. And certainly our own experience hasn't really made us terribly concerned at this point in children specifically.
Thank you. I think we have time for one last question. And so I'm going to ask this last one about COVID fatigue. Is there any way to keep motivating ourselves and our kids so that we're supporting mental health and socialization for our children? Any tactics you would recommend for coping with the fatigue that comes from this very long pandemic situation?
I think that was one of mine. I think there are a few principles that I would recommend. First of all, I think parents should realize that children pick up on our attitudes and our moods very intuitively. Even teenagers who think we're all idiots are still very affected by our attitudes and our moods. And I think for that reason, we have to try and be as hopeful and optimistic as possible. And quite frankly, I think it's not inappropriate to be hopeful and optimistic. I think clearly it's been a very long year and a very difficult year. But I think particularly with the emergence of the vaccines that Ronnie spoke about in the beginning, I think we have a lot of reason for optimism and a lot of reason to believe that we're past the halfway mark and that things are going to get better as the year goes on. So I think that's an incredibly important point. I do think there's some other things we've touched on: exercise, getting whatever type, whether it's going for walks or skates or running or dancing or whatever exercise you like. Routines are important. Children feel safe with routines. And I think certainly during lockdowns or virtual school, it's really important to try and maintain the normal meal times, the normal bed times, school during the week, off during the weekend, those kind of things. Socialization, we've talked about, making sure that the children are connecting with their friends and with family through technology. I think family time, really important. This is one positive, certainly for my family, that's come out of this, is we spend a lot more time together and done some fun stuff and some good stuff. So those are some things. And I think people shouldn't, I don't think people should hesitate to look for help if they're struggling. I mean, we all know that a lot of people are struggling at this time, and I think that's an important thing to recognize. And certainly there are resources out there available for people who might be struggling.
I think that, does someone want to add to that? Go ahead, Ronnie.
I'm going to add one more comment to this. I think part of the COVID fatigue also happens through some of the exposures we see throughout the media, and particularly social media. Mm-hmm. And I would like to encourage all of you, I'm not going to tell you not to go on the media or social media. This is part of our life now. I just encourage all of you, there's a lot of apocalyptic language around many different aspects of COVID, including schools. I think Michelle spoke about it. Our teachers, school boards have done an unbelievable job so far. And we know how hard this is to implement all these bundled measures of health and safety, but it's kind of our job to do this. And we know it's not your job. You didn't sign up for this. So, but I think most of the schools and teachers have done an unbelievable job. It was by and large successful and safe to go to school. And I guess I encourage all of you to just take a step back when some of this vitriol language and these comments occur on social media. None of this has ever helped anything in the history of human kind. And I think, as Jeremy said, we are probably past the halfway now. 2021 didn't start as good as everybody thought it would. It will end much better, and it will get better before the end of the year. So thank you.
And I think that's a great place to end our evening. I can't tell you how helpful your report was to us as educators as we got ready for a September, an unimaginable September. You're right, teachers and education workers have been working so hard to make life normal and joyful for children and to keep the learning going. And we couldn't have done that without the work that the medical community has done to guide us through this period. So thank you for engaging in this partnership with us. I love what Michelle said, that we all have to do our part. I would be lying if I didn't say that we as educators are nervous about going back to school in the next few weeks, but we also know it's the best thing for the children. And so we're willing to take that risk of being there with them and making sure that they are healthy and they are learning and they are having fun and playing and doing the work of children, which is the work of play. And so I want to thank you for giving us so much good information. For our audience, we will send out this video. And if there are any questions, important questions that we didn't get to, we will try and get them to you on paper. I guess not paper, electronically. And I want to thank these three doctors for all the incredible work they're doing, their leadership during this time. And thank you to all of you for participating and making this such a wonderful evening.
Thank you for having us.